As podiatry, today we have the good fortune of having a pediatric patient. We do see a lot of pediatric patients here at Jaws Podiatry. Very atypical presentation until proven otherwise. A wart on the top of the toe. Let's take a look. So let's get it, Melissa. Let's get a nice close up there. So this is looks like a little kernel, a corn kernel, and it's definitely firm. Okay, and we can definitely move it, and it's been there for a couple of weeks. The patient is very active nonetheless, does play soccer. The parents were telling me that he has been in, I guess, in a public pool lately, and I guess they've made the mistake of maybe, not using any water socks and so on and so forth. So what we're going to go ahead and do, there are different ways, okay, to treat warts in general, whether it's cryotherapy, whether it's surgical excision, whether it's chemical cautery. There's just a lot of different ways. There's not only one way to eradicate a wart. In our past videos that I've presented in respect to plantar warts, I think a lot of people know that I do not like, especially for pediatric patients, this is extremely traumatic, right? This experience is a very traumatic experience for the patient, more so when they're younger patients than older patients. I feel very strongly of not performing the curettage, basically just, numbing the area, extremely traumatic. That's number one. Then taking a curette and curetting all that tissue, extremely traumatic. And then also the complete surgical excision of the wart. Again, extremely traumatic, local anesthesia, the needle, the whole entire experience is very, very traumatic. And I continue to say that word because it really, really is. In the last 13 years, what I have used, as everyone knows it, is the beetle juice, the cantharone, and it's extremely effective because it is extremely, extremely powerful. It is an acid and it works really, really well. The nice thing about the beetle juice is that it doesn't hurt. It's completely and totally painless. So in respect to the experience, for mom, dad, as well as the patient, it's a win-win-win-win for me as well. Okay, so the first thing that we're going to do is I'm just going to remove the top layer, just to make sure that come around here, Melissa. Let's give everyone a really nice close-up view there. Just focus, zoom in there, all the way there, more, perfect, there we go. And basically, we try to remove a little bit of this, right, just like that, very carefully. Trying to give everyone a really nice look here and a visual. And again, a very atypical location. We don't see a whole lot of these on the top, especially in kids. Okay, the pinpoint bleeding is totally normal. He did not feel anything, right? And I will go ahead and explain that a little bit more. So these warts in general, the virus, they survive and thrive from, obviously, blood. That's how they survive, blood. So imagine these little roots underneath the wart, and these little roots are the ones that are feeding the virus in order for it to survive. Déjame saber si te molesta, okay? Let's get a nice close up there, yeah, so that everyone can see. This is what we call the pinpoint bleeding. Thank you, Melissa. So we're going to continue to take just a little bit more. Okay. And just like that. ¿Está bien, papi? And again, he doesn't feel any discomfort because at this level, we're still... ¿Sentiste un poquito? ¿Dolor? No. Un poquito más y ahí terminamos. We're gonna go, I've just told the patient, we're just gonna take a little bit more. Okay, now we've exposed, we'll just say the first layer of the wart. I think that's good enough for today. But also, vamos a ver el otro. El otro piececito. The patient also, póngalo aquí, ponme el piececito así, no, derechito, así, y ahora para arriba. He also has two little ones here. Two little ones. Two little ones on the right foot, right underneath the great toe, right here. ¿Está bien? ¿Dolor? Coquilla. Ticklish. That's why he's moving the... Okay.
¿Con la misma cuchilla ahí no le pasa lo mismo para allá?
No. Es lo mismo. Buena pregunta.
Sí, porque imagino.
No, eso es verruga. Verruga, dos verruguitas. Two little warts. And as everyone can see, there's a lot of... Yeah.
Y de eso es lo que hace.
Yep.
Un callo para mantener el virus ahí.
Yep. And you see the same thing? You have the pinpoint bleeding. So he didn't feel a thing. And we'll put a... I think on the right, these two, we can definitely eradicate with one application of the beetle juice. I know we're in the right location because it's already up, and there it is, okay? So now we're in the right place. So, without further ado, okay, now Melissa will stay there, and I'm going to come around and get the beetle juice.
Puede estar ahí, pero si está abierto.
Okay, so what we're going to do is we're going to put a little bit of pressure here. Okay. Okay, so now the first thing, again, we have the beetle juice here. Okay. This is extremely strong, everyone. Mom just asked me if it burns, and I said no. Okay. Now we turn this around.
¿Cómo se llama ese líquido, doctor?
Esto se llama canthrone. Canthrone.
Y es hecho de beetle juice.
Sí, ya.
De beetles.
De virus.
No, él ya lo dijo.
Bees.
Escarabajos.
Escarabajos. Now let's go, as everyone can see. Melissa, over here, please. Everyone can see it's white. That's the reaction. You see that?
Y le puse suficiente cantidad como para que
Hay que tener cuidado.
Sí, ¿no?
Sí, de eso es quemar. Eso es lo que está quemando el virus.
Let's go now.
Sacándoselo.
Let's go to the right. No, aquí mismo.
Que le eche un galón. Para que se le vaya ahí ya.
No, pero ahora eso se le hace como un...
We want to make sure that there's no blood, because the blood will actually also deactivate the canthrone, the beetle juice.
Tiene que abrirle hasta que salga la sangrecita para poder entrar, imagínate.
Okay.
Y te pica un poquito, pero ya fuera de eso. ¿No te ha picado?
No, es parecido como normal. Es normal.
Did that hurt? Did that hurt what I just did to you? Did it hurt at all?
No, but the part what you did in my left foot, yes, it did hurt, but only a little bit.
But very little?
Yeah.
Okay, so everyone heard that. Everyone heard that. That was the patient. I guess, you know, did feel a little bit, probably a little bit of discomfort, just the debridement of the top layer of the callus. And believe it or not, that's it. So now we wait 2 weeks. They will come back. On the right, I suspect that we will definitely eradicate the 2 lesions on the right, and on the one on the left, I've already discussed with the parents that maybe 2 or 3, even sometimes even 4 applications every 2 weeks. But you know, talk about a wonderful experience for everyone. This is exactly what I mean. It's definitely a great practice builder. A lot of podiatrists do use cantharone as a first-line treatment for warts in general. So like always, www.jawspodiatry.com, Instagram, Dr. Toe Jam, Jaws Podiatry, Facebook, and last but not least, our YouTube channel.